I'm Tony Storis. I'm chairman of the board. I'm at home with my trusty dog, Luca, and there's nobody else here. Go ahead, Steph, you're up.
Stephanie Wolf Rosenblum, member of Board of Health. I am, despite my background, at home, and there's nobody else here, and I can hear you. Thank you.
Are those lilac bushes, by the way?
They are not. That's a tree in Jerusalem.
Oh, okay, because I was going to think it's a little bit early for the my bushes aren't open yet.
No, I'm just thinking spring.
Yeah, I like it. Heidi?
Sorry, I got distracted by something.
No problem.
Introduction, I'm assuming?
Yes, please.
Okay, thank you. Heidi P. Kokoka, Health Officer for the City of Nashua.
Thank you. Angela, you're next batter up.
Hi, Angela Constantino, epidemiologist.
Okay, thank you very much. Jane?
Hi, Jane Goodman, Public Health Strategist for the Division of Public Health.
And Jane will be actually giving us Bobby's notes because Bobby is off this week. Nicole?
Hi, everyone. Nicole Schuh, Health Promotion and Communication Specialist at the Division of Public Health.
Thank you, Nicole. I want to let you know that I've been fending off all these offers to go on TV after they saw that picture, by the way. Rennie?
Hi, everyone. Ren Bodwin, Environmental Health.
Thank you. Flavia?
Flavia Martin, Public Health Nurse.
Thank you. Sandra?
Sandra DeLosa, Nashua City Welfare.
Thank you. Bob, are you there?
Good afternoon, Bob Mack, Welfare Officer for the City of Nashua.
Thank you. Hey, Dr. Capetta is with us.
Yep. Hello, good morning. Chuck Capetta, Board of Health. I'm at home and no one's around.
And smiling too. Okay. Patty, I think you're joining us today too. Is that correct?
Hello.
Hi.
Patty Crooker, Public Health Network Services Coordinator. I apologize. I'm in my car. I just snuck out of a clinic a bit early to join you guys, and then I have a site visit.
Okay.
In Milford.
Are you reporting today on anything, Patty?
Yeah, just on vaccination, or
Okay.
vaccination clinics.
So when you get to wherever you are, let's get you situated
Yep,
and say.
I'll be fine in a couple minutes. I'm going to park while I'm on the phone.
Okay, sounds good. Okay, guys, I'm calling the meeting to order because we do have a quorum. The first thing on the order of business should be the approval of the February minutes. I need a motion to do that.
Yes.
Go ahead. And Stephanie seconded. Now, any revisions, edits, house cleaning, anything that needs to be done that may be incorrect or needs qualification?
One comment I think we had raised before about putting our names next to these comments.
Yes.
Is it, I know it says, I was looking through it last night, that it seems, I'm happy to have my name next to it, as I'm sure Steph is too, but I also it might be nicer just to say Board of Health or something that just generically puts it out there versus comment after comment. It sounds like a conversational discussion versus a board of minutes, if you know what I mean.
It is kind of unusual to do that. Maybe we can correct them moving forward, unless there's dissent. You know, you can have a comment that seems to be 2 of the 3 people and somebody's dissenting. They do have the right to write a statement of dissent that I don't agree with that 100% or, you know, whatever. So that way we're not muting people by ganging up on them 2-1 unless there's an actual vote. Stephanie, any comments?
I agree with that. My suggestion, especially since the topics that we're discussing are more and more public or generating more and more public interest, that it would be fine if the meeting notes were taken in that fashion so that we had a draft with names. And if we had a question about, you know, needing to refer back to an individual that said it, but as far as the published comments, I think that name should be member Board of Health, member Public Health. I just think to the extent that our names are not out there, you know, because often we have consensus, but it accrues to the person that said the original thing. So I agree entirely.
Okay. Is that good with you, Chuck?
Yes, that'd be great. Thank you.
Okay, those in favor? Aye. So be it. One interruption. Tom Lopez, you're here? Alderman Lopez? You're on mute if you're talking.
Sticky button. Sorry. Yep, I'm here.
Okay, thank you very much. Voting on the actual minutes from the last meeting. Those in favor, as amended.
Aye.
Yes.
Okay, unanimous. Moving forward, Jane, would you like to take the director's report, please?
Sure, thank you. So as you already said, Director Bagley is on vacation this week, so I'll be reporting out, try to summarize this lengthy list of things that's going on. Just as usual, we are doing all things COVID, contact monitoring, surveillance, case investigation, contact tracing. We're still staffing weekly testing clinics, providing hotline coverage, education, still having a lot of mitigation messaging going out. As Chief Public Health Strategist, we're still working collaboratively with community partners, sending out weekly newsletters, sending out situational updates. We still have our radio show and our Public Health Matters, and thank you to Dr. Rosenblum, who joined me last week on that show. Moving on, the director continues to lead and support staff and collaborate with community partners. We have hired an additional community health worker. They'll be coming in on March 22nd. I believe they're fluent in Spanish and English, of course.
Great.
Oh, and French Creole. We've reviewed the 4-year accreditation report. Strategic planning process is underway. The CHA final report has been published, and the CHIP planning documents. And so I'm just going to interject here because I'm not officially on the agenda. One of the reasons the director asked me to give this is to let you know that we are launching the Community Health Improvement Plan health prioritization. That will be tomorrow afternoon. You've all received an invitation. That's gone out to the Public Health Advisory Council, the Executive Council. And I'll be sending out a reminder about that this afternoon, but that's the first step in getting the Community Health Improvement Plan launched. And also internally, we're working on our strategic plan. Many of you have probably received a Survey Monkey as well, asking our external partners to weigh in on how we're functioning as a division. So if you, I never miss an opportunity to ask for responses. So if you have a moment, please respond to that, because it's important for us to understand what our external partners are thinking about our work, as well as what we think about our own work. We continue to support the school superintendent as they move from remote to hybrid class sessions, participating in the State Health Improvement Council and subcommittee, met with the governor's equity response team. And I'm going to skip over, I'm going to graze over a few of these things. You all have the printed report. Attending the mayor's town hall, providing weekly testing at City Hall. The director is serving as a preceptor for nursing leadership student, and we have medical students from the School of New England Osteopathic Medical School. We're participating in community vaccination clinics and testing clinics as scheduled. Recently submitted an application for the CDC Public Health Associate position and submitted the quarterly report. The director served as a panelist for the University of Chapel Hill Public Health class, and of course has participated in interviews with WMUR and NHPR. We've set up some contracts for strategic planning and also for the NSKS warming stations. Our total staff is at 37 at the division right now, and our CDC surge capacity contract was extended for Sarah Syed, who's a communications specialist, until June 30th, 2021. We do have a current medical student with us from UNE, and we do have a nursing leadership student also from Riviere. 2 new medical students will be completing their rotations, and they'll be starting on March 22nd. Other highlights, the COVID-19 vaccination efforts are recognized by the Division of, have been recognized by the Department of Health and Human Services and regional partners. We're a little bit out of the gate faster than some of the other public health networks. I'll let Patty talk about that. And we've successfully vaccinated over 2,000 residents in 6 weeks.
Wow, that's awesome.
Oh, nice job.
So again, multiple press conferences and media coverage on COVID-19 activities, not just with the director, but with a lot of members of the division. And that's all I have. Thank you.
Thank you, Jane. Any questions or comments for Jane? Seeing none. Seeing none.
I have a comment.
Oh, I'm sorry, Tom.
It's worth noting that with all of the resources and multiple expansions to our public health capacity over the last 2 weeks, they have achieved 2,000 inoculations, and that's like almost 2% of our city. So not quite ready to be celebrating all the reopenings and unmaskings yet. It's going to take a while.
Yeah, I think we're going to be probably discussing that too. Thank you for reminding me.
No shade on public health, just for the record.
And
But I'm just saying, like, with everything we do, it takes a while.
Oh, yeah.
And I would just like to, there's a caveat to that. We've done 2,000 at our clinics. That does not include the rest of the people that have been done at Nashua South at the fixed site. So there are many more than 2,000 that have been vaccinated in the city.
All right. Well, I mean, so we're further ahead, but it's still not like, we're not quite at herd immunity.
No, but I think we're gaining momentum. And I think Patty also has some news along the way as far as vaccines are concerned regarding the Fidelity people. So I'll leave that for her. Just give you a little taste to tease you. Any other questions? I also, Alderman Lou, welcome. Do you want to acknowledge yourself, please?
Oh, I would love, yes, hi. I am here alone and I can hear everyone. And I'm Alderman Lou from Ward 6. Thank you.
Okay. Thank you for coming.
Any questions since I have your mic open? Any questions that you might have at this point? Okay, thank you. Is everybody okay with Bobby's report as presented by Jane?
Yes.
Okay, good. All right, we're moving on my list. Community health, I'm not sure who's giving that today.
That'll be me. I'll give the report out for Kim.
Sorry about that.
Yep. So while we continue to maintain COVID-related activities, our disease investigation, contact tracing, monitoring, vaccination, and education, February saw a decrease in total number of cases over the past few months. We had 605 total cases in Nashua. That's a 65% decrease over the previous month in January. And we had 3 clusters or outbreaks. We also saw an increase in vaccination activities, as Jane reported and as Patty will mention as well. Several community health department staff are leaders on the COVID-19 vaccine strategy planning committee for the division, working closely with our community partners and the HHS with vaccination rollout. Considerable time and effort went into training volunteers and staff, recruiting, vetting, scheduling for all the clinics. It was a really immense task, from ordering the supplies, vaccine, to proper storage and handling, to all the way into delivery of the arms of the vaccine recipient. And Jane had a better number, but in February alone, I have a number of 1,616 total vaccines delivered through our own clinic. And Community Health Department continues to provide our weekly, our regularly scheduled program, our weekly sexual health clinic every Thursday over at Lamprey Healthcare. Every Wednesday at the library, our child and adult immunization clinic every Wednesday at the library, and Tuesday in front of Elm Street Junior High. Sauna services continues twice weekly, as well as our lead program and lead poisoning awareness and testing and case management. And I think that's it for highlights.
Thank you very much. I think Alderman Lopez had a good question, and I was going to bring it up later. Flavia, maybe you can answer it. Can we get those numbers from the National Guard of the people that have been vaccinated, so we kind of have a running total. I do know that Walgreens is also doing some as well, and I heard rumor that CVS is either started or is going to start as well, and I'm not sure if we get those numbers or they're sent to the state, but maybe it'd be a good idea for us to know, we're gaining, we're moving forward.
Absolutely. We would love to have that number. Patty, do you want to elaborate?
Yep. I was just going to say, we have asked the state about it. We currently do not have access to numbers broken down by municipality or by public health region, but it is something we have requested, and we're anticipating the launch of their the launch and expansion of their vaccine dashboard shortly. So hopefully within the next couple of weeks, we'll be able to get some more numbers. But I can tell you that the fixed site is seeing anywhere between 500 to 1,200 people a day at Nashua South.
Okay. That's good. That's good that it's in the works. And maybe, can I leave it up to you to get that information to the board?
Absolutely.
Thank you.
Anxiously awaiting that dashboard with the breakdown.
Well, maybe on one of our meetings, you can actually show us how to access it ourselves and what have you. But that I think that's an important number that should be reported and certainly should be transferred over to the Board of Aldermen to let them know, because I'm sure they're getting questions as well, and we don't want to leave them in the dark. Okay. Any other question? Yes, Tom.
Just a comment. It sounds like we're doing way better than the initial 2,000 that I thought we had. So that is very encouraging. And likewise, being able to identify the risk that people are still experiencing locally is just as valuable. Well, I mean, it's equally valuable to show the progress, because this is a combination game of how far are we from where we were and how close are we to where we want to be. So yeah, I think that information will be very helpful. And the alderman could probably definitely benefit from it.
Okay. Is that good for you, Alderman Lou? You're on mute.
Yes, thank you.
Okay. Anyway, seeing no more questions or comments, I'd like to move on to our epidemiologist's report. Angela, are you still here? Oh, there you are, upper corner. It's like playing bingo here. It's like, where is everybody? Okay, you're on.
So Dr. Strauss, I have a COVID-19 report. So as of today, we have 117.6 million cases worldwide. 29 million of those are in the US, with 527,000 US deaths. In regards to community level transmission here in Nashua, we're currently exceeding 1 out of 2 indicators that push us into substantial transmission. So over the past 14 days, we've had 183.5 new cases per 100,000 people, which is down about 100 standardized cases compared to last week. We're then considered minimal in regards to the percent positivity category. So in the past week, there has been 315 tests conducted on average each day in Nashua residents, and 11 of those tests have been positive each day, which gives us a percent positivity rate of 3.5%. This is compared to the state's rate of 3.7%. In regards to our case activity, there are currently 6,501 cumulative cases in Nashua. Of those cases, approximately 77 are currently active and infectious. We've had 1 additional death this week for 80 total deaths and a case fatality rate of 1.2%. Our hospitalization rate in Nashua is at 1.9% compared to the state's rate of 1.4%. And then in regards to the state as a whole, there's been a total of 77,252 cumulative cases in New Hampshire, about 2,000 of which are currently active. In regards to trending, last week we had 67 new cases reported in Nashua, which is down by almost 7 times to what it was in the week between Christmas and New Year's. This is similar to the weekly number of cases we were seeing at the end of October. Also, the 7-day average of new deaths is down 85% this week compared to the winter surge. This is also similar to the number that we were seeing at the end of October and the beginning of November. And then the number of people getting tested is also down to what we were seeing at the beginning of November and end of October. About 300 Nashua residents are tested per week. Bobby also asked me to give an update on vaccination numbers. So I know you heard a number from Jan, a number from Flavia. So I have the unduplicated individuals number of people who have been vaccinated at our clinics. So 1,960 unduplicated individuals have been vaccinated by us. 21% of those people have been fully vaccinated, which means they received both the first and the second dose, and 79% have received just their first dose. 47% of our total vaccinations have occurred at our equity clinics, and 33% of all vaccinations have been given to those that are Hispanic or Latino. 6.7% have been given to those that are Black or African American, and 3% of those vaccinations have been given to those that are Asian. And then Bobby also asked me to provide an update on the variants of concern. So in February, B117, the variant that was originally detected in the UK, was found for the first time in New Hampshire. We have since had 6 cases associated with this variant. This is currently the most widely circulated variant worldwide. The of concern are the P1, which was originally detected in Japan, but is widely circulated in Brazil. And then the B1351, which was originally detected in South Africa. So all 3 of these variants have the mutation that makes them more transmissible, but the P1 and the B1351 also have the escape mutation, which allows them to more easily evade previously established antibodies. Currently, in regards to prevalence, the B1351 is more prevalent in the US compared to the P1, and B1351 cases have been detected in Massachusetts, Connecticut, New York, and Maine. So other than COVID, we officially published our 2020 Community Health Assessment, and we are reporting out those findings tomorrow during our Public Health Advisory Council meeting. So we're very excited to talk about those findings and get that information out there. We continue our work on performance management and quality improvement. We're in the data collection and analysis phase of our 2021 PMQI project. Our strategic planning work continues. We did a division-wide qualitative strengths, weaknesses, opportunities, and threats assessment in February. So we're currently processing and coding those results. And then we have our community health improvement plan, which Jane gave an update on. But I just wanted to share the CHA-CHIP cycle that's in your Board of Health notes to show you where we are in the process. So we just finished our assessment phase with the community health assessment, and now we're moving on to our prioritizing and planning phase with our new community health improvement plan. And that's all I have for today.
Thank you, Angela. I'd also like to, I'm not sure if the other members of the board have received the SurveyMonkey survey yet about the division. I suggest it take about 5 minutes to do, but it gives you a good way to give feedback to the whole department and what's going on. So I'd ask you to take a moment and to do that. Any questions on anything for Angela? I will say that I think I read her CDC report that the variant, the British variant 117, is up to 40% now of the infections that we're seeing in the country. It's obviously very contagious, and it's actually spreading across the country. I have not heard anything about changing the vaccine for these. Stephanie, have you heard anything in that?
So far, the testing has shown that there is perhaps a decrease in efficacy for preventing all disease, but it appears to be able to prevent hospitalization and death. The J&J vaccine was tested later, and I think it's a reflection of that. However, several of the vaccine manufacturers have already begun developing new formulas for vaccine, so that over time we can see the vaccine evolve to better meet this. And whether or not we will need booster shots, depending on which one we've had, or what the timing of that will be, is still to be determined. It's really an unprecedented amount and rapidity of scientific information coming out, and it changes almost daily. But the manufacturing process for the mRNA vaccines is quick. And now that people have a better handle on the safety and efficacy of mRNA vaccines, it will be less cumbersome than what we've heard in the past about trying to turn on a dime with the flu vaccine grown in the chickens.
Right.
Angela, would you add anything to that? Does that resonate with what you've been reading?
Yeah, I've seen that the B1 351 and the P1 are the ones that look like they're going to be less able to be vaccinated against, and Moderna and Pfizer have come out and said that that's looking kind of like what it is, but overall it reduces mortality and serious illness.
Chuck, do you, anything from the pediatric kind of angle?
No, it's just relevant to the letter that came out. We'll discuss at the end, but not on this topic. Thank you.
Okay. There was something else I was going to say, but I forgot, but that's old age. Well, I know what I was going to say. That being said, the fact that we have the variants and it's not just, 1 or 2 per million people at 40% and spreading, it means we still have to keep our guard up, especially in light of the fact that we know that they have the ability to bypass the immune system, the antibodies that we're hoping everybody's going to get with the vaccines. So obviously, you just can't, walk around and think that you're totally immune and then point a finger at somebody and said, well, why didn't you tell me this? Well, we're kind of telling it as we're going. You still have to keep your guard up. You still have to do what you have to do. Thank you, Angela. Anything else that you wanted to add in light of our talk there? Are you good, Angela?
Yeah, I'm good. Thank you.
Okay, thanks. We're moving on if that's okay. Nicole.
Awesome. Hi, everyone.
Hi.
So throughout the month of February, I continued to provide public information related updates in our ongoing meetings with community partners. And that includes continuing to facilitate our joint information center meetings, which occur every other week. With the new information that has been coming out in regards to vaccines, especially with the phases and the new Johnson & Johnson vaccine, I have been continuing to update our website and social media pages with the latest information and recommendations. So last month, as you can see behind me, we have them all printed, but we did print fact sheets and posters with vaccine information. And these were printed in English, Spanish, Portuguese, French, Swahili, and Kinyarwanda. So our staff has been working really hard to distribute these throughout the community. And they go out at testing and vaccine clinics through outreach by our community health workers. We've gotten some into local grocery stores and businesses. And we also got them out to some families through the Nashville School District lunches. We are also providing educational bags at our clinic. So these bags have a COVID brochure, the vaccine fact sheet. We give out masks, hand sanitizer, thermometers, and information about our mobile outreach services. And then for the next few months, we are going to be running a billboard in Nashua and Merrimack to promote the vaccine. We also have a few rear bus ads, interior bus ads, and bus shelter ads that are going to be up in Nashua. Those just got put up this week. So I saw 2 on my way in this morning, but if you're driving around Nashua, you might see Bobby's face on some of the bus shelters. And then we're also going to be running a mobile campaign that starts next week, and that's going to be in Nashua, Hudson, and Milford, and it'll promote our vaccine webpage. In addition to that, we're also running print advertisements in some local newspapers. So that's going to promote the vaccine in English and Spanish, and we're doing that through the Hippo and through the Rumbo Spanish newspaper. And then last month, we did film some PSAs, which I think I mentioned at our last meeting, but they are completed, and they're videos with local healthcare leaders about why they've received the vaccine and just a little bit about their vaccination experience. So those are completed and they're posted on our website. We just got them this week, so we'll be sharing them in our newsletter as well as on our social media pages. And our end goal is to get them running as a PSA on WMUR, but it's a little tricky process, so I'm working on that now. And then also we did record videos with our community health workers in Spanish, French, and Swahili, and they answered questions about the vaccine in their languages. So those should be ready for distribution next week, and our community health workers will work on sending those out. And St. Joseph Hospital actually has been creating videos as well in different languages, so we're sharing those for them as well. And the hot topic right now, we are working on disseminating messaging around St. Patrick's Day. So we showed the flyer at the last meeting, and I'm sure Environmental Health will talk more about this in their report, but they have been conducting outreach at local food service establishments and businesses just to provide education about keeping their staff and customers safe. So we've posted this flyer and information on Access TV, in our newsletter, and we're currently running a Facebook ad right now on Facebook, encouraging ways that people can celebrate St. Patrick's Day at home. And then in addition to that, just for messaging, in February, we focused on American Heart Month, Black History Month, child's dental health, eating disorders, STD testing, and winter weather safety. So then in March, we're really focusing on nutrition, colorectal cancer screening, poison prevention. We have World TB Day coming up, which we have a billboard out for right now, lead poisoning prevention, and a heavy focus on mental health. And then, as Angela mentioned, our community health assessment has been published. We're in the process of printing some rack cards to promote the CHA, and these will be distributed at our clinics and during Public Health Week. So for an update on Public Health Week that's coming up April 5th to 11th, we did send out an invitation to our community partners, encouraging them to host or participate in activities that promote health throughout the week. So we will be setting up outreach tables with educational bags at a variety of community locations throughout the region. And this includes the YMCAs, PAL, our Adult Learning Center, the United Way, some recovery centers, community centers, and a few other locations. So these bags will include a variety of COVID and public health information with information about our services as well. And we've also distributed our Public Health Week flyer to all the regional libraries and other organizations, including food pantries and social service organizations. We've also sent out TV slides to the libraries and regional community TV sites just to really spread the word. Other than that, so just additional business. So we did wrap up the work with our marketing and communications consultant. She hosted a workshop for our staff on February 24th, just to wrap up the work as branding us as Chief Public Health Strategist. So overall, this was a really great experience. And moving forward, I'll be using the communications plan that we created with her to continue branding the division. And then I just wanted to mention too, for community health, we're working on promoting immunizations. We have an ad right now that promotes that immunizations are essential for children as schools are opening back up. So we have some print ads in English and Spanish. We also are doing a Facebook ad. And we're doing the same thing to promote that you can still get the flu vaccine as well. And then I guess last thing I'll mention, as you can see in one of the pictures in my report, if you guys have it, we did get a really big banner or backdrop that says I got vaccinated against COVID-19. And we're bringing that to our community clinics. So we've just been doing a really good job. And I thank all our staff for taking pictures of our staff at the vaccine clinics. And we've been promoting that on our social media, throughout our newsletter, and on our website. And that's my report.
Thank you, Angela. Any questions for her? I just want to know why Bobby has a better agent than I have if she's on the bus stops. Anyway, we're moving on. Environmental health, Heidi and Ren.
Good afternoon, all. Heidi Pikakoka, Health Officer for the City of Nashua. I'm going to make mine brief because I know we've got a topic of discussion coming up, and we want to get to Patty and some vaccination details as well. Environmental health specifically is we're still employing the all hands on deck approach and are immersed in COVID activities. Find a lot of them to be very gratifying with our mission to pure public health. We also, as Nicole had mentioned, we did provide those St. Patrick's Day brochures and some of our special green masks that you can see both Nicole and Ren wearing to area businesses. I had written 57 establishments in my report, but it's actually closer up to 59. And we also did stop by some of the barbershops and some other retail establishments as well, just so that there's a baseline of familiarity with some different options for how to celebrate safely. Let's see. It's been a busy month with school inspections. Those usually take about a half a day to walk through an entire school room by room, so it's pretty staff heavy, but we have no control over the schedule that Department of Education puts forth, but we try to accommodate them to the best of our abilities. But it is a little bit of a struggle, but it's something that's important that it's done well. We've also been busy working on outdoor dining activities for downtown, and Angela, Ren, and I met with Paul Shea from Great American Downtown yesterday to discuss some of his plans for the upcoming season. We're also getting ready to move a little bit more forward with our licensing software, which is exciting, but it's going to take up an awful lot of time to accomplish that, but we're very grateful. Ren, anything that you would add?
Thank you, Heidi. No, I think that's it. I have no further updates.
Thank you. Any questions for Heidi or Ren?
I
Yes,
have a
Steph?
question.
Go
This
for
is
it.
all great. This is all great work. In addition to the looming holidays, a number of and nonprofits and others will be looking to have events, whether they're preparing their own foods or whether they're hiring vendors for food trucks or such. And so it's not urgent today. And as you pointed out, we have important topics to discuss, but I would very much like to hear in some detail at the next meeting, and maybe just a brief summary today about what your plans are for educating and licensing events.
Sure. Well, your question is very timely because we've been working on that, and we have a guidance document that's been updated so that it's up to current standards that we're getting ready to send out and disseminate as well. But I don't remember who I said it to, but in the packet of that information that we had sent previously for events, it contained a document that our communications people put together. And I was thrilled with how relevant the information still was. It was still spot on a year later. So I really appreciate how we work best together as a whole team. But it is something that we are working on, and we can share the information certainly as it's all done.
Yes, please. If you could send copies of that so we could review it outside the meeting so that it doesn't take time. Thank you.
Sure. Happy to.
Tom?
But some of us take longer than others to plan events. So would I be safe in planning a Tree Streets block party for the end of June, or should I just hold off?
Depends upon numbers and activities, but I would be happy to have somebody walk you through that if I'm not available, and we can certainly talk about each of the different scenarios.
Okay, I don't want to monopolize one of your department staff members, but it would be really helpful to have one giving input on that kind of thing. So maybe as an alternative, we could plan like a late March or April event planning forum where people could meet. I think you were present a couple years ago when we had like the all cities departments one, where basically someone was coming into an event. We had a lot of confusion back then about how to run events and stuff. So maybe just having one with general guidelines where multiple people who might be planning multiple events, like Great American Downtown or whatever, you could answer all those questions at once.
Yeah, I think if that didn't work out for the whole city, but would be happy to help bring people along to the best of our ability. I'm not sure what the forum would be, but we're always happy to talk to people, whether it's as a group or individually.
Okay, sounds good.
Thank you.
Any other questions for Heidi or Ren? Seeing none, we'll move on.
I'm
Bob,
sorry, Dr. Moritz?
go ahead. I'm sorry.
Thank you. That's okay. I was slow. I just have two questions. I don't know at what point they should be directed, but they're very brief.
Okay.
Just what is psychological overdose? And my other question is, we have homeless in the city, and I've wondered whether we have any place that we provide information on resources from this department for people who don't have a home. And I don't mean to address their homelessness. I mean, do we have any physical spots where we post things for people who don't have a computer?
Heidi, do you like to take on that, or at least one of those questions?
I learned a lot when I acted as safety officer for COVID and saw the inner workings of a lot of city departments. And certainly the library is a hub for people who are currently experiencing homelessness or at risk of homelessness. So there are a lot of things posted there, and when they are open and available, it's one of the only places that still has a payphone, and other than say the hospital settings, and they can also sign up to use their computers as well. Bob may know this better than I do.
Go ahead, Bob.
I may thank you, Bob Mack, Welfare Officer for the city. I do know that, Nicole kind of mentioned this earlier, all the materials that she works on and that the division works on and different communications are pushed out to different networks and different organizations. There's always an outreach to say, please push this out to your networks of organization and agencies you work with. One of those major networks is the Greater Nashua Continuum of Care, and they specialize in working with the homeless and at-risk population. And I think a lot of the communications are pushed out to them so that they can either post them at their physical locations or share the information with the clients as they come into contact with them. I also know that the outreach teams in our community are very involved in that communication network as well. And so they're either giving out physical information or verbal information and trying to direct people to the most appropriate resources.
Thank you, Bob. Does that answer your questions?
Yes, thank you.
Okay. Any other questions or comments? Sorry, I didn't pick you up as quickly as I should have. I'd like to move on to Bob, since you're here and live. I think you're here. I don't see him anymore, but there you are.
Sure. Bob Mack, Welfare Officer for the city.
I was actually having a tear down with you, and then I realized it was just a picture.
Yeah, I was just holding very still. Anyway, let me get into the report for the Welfare Department for February. Just quickly, our expenditures were actually pretty much level to where they were last year at this time. Most of those expenditures are in rental assistance and some emergency shelter assistance in motels. The bulk of it is prevention. It's always more effective to keep someone housed than it is to try to rehouse them. Our contacts have gone up a little bit compared to last year. I think a number of those contacts are COVID related, but many of them are also just related to day-to-day requests for assistance through the department. Let's see, we have expended about $260,000, which is about 48% of our allotted budget for the fiscal year. We continue to monitor those expenditures, and we continue to refer folks to other resources in the community. There are a number of organizations that do eviction prevention. The state is also receiving a significant amount of money for a second round of emergency rental assistance for folks that are experiencing COVID-related financial situations and circumstances and need assistance paying their rent. Those applications will start up March 15th, and those will be again running through Southern New Hampshire Services. I believe that New Hampshire Housing Finance Authority is kind of overseeing the implementation of that program this go around. We continue to work with our community partners. We have also undertaken a quality assurance survey process to kind of get a sense of how we're doing as a department as part of our quality improvement planning. And we've just gotten this started, but the review of the first results show a very positive response to the welfare department in their ability to assist clients and the staff response to client needs, and whether that's direct assistance or in referring them to other agencies and organizations. So we'll try to continue that trend as we work with folks that are in need. So I think quickly, that about sums up the report. I don't know if there are any questions, or Sandra, I don't know if you have anything else to add.
I don't have anything else to add.
Okay.
Thank you very much. Any questions or comments? I don't think I see anybody. Thank you very much, Bob. Moving on to Patty regarding the vaccines. Uh-oh.
Hello, I'm
Hi,
here.
Patty. Okay.
How are you?
Very well, thank you. It's good to talk to you again.
I know. I can turn my camera on. Oh, me
Keep
from
your
my
eyes
car.
on, your eyes on the road.
Oh
Come
no,
on.
I'm stopped. So we have been very busy holding our COVID vaccination clinics. I think one thing to be clear about is that the public health networks were tasked with different pieces of our vaccination strategy for the state. So as opposed to vaccinating the full population, which is really what the fixed sites are for, we were tasked with originally helping out vaccinate first responders, so police, fire, EMS, as well as our COVID vaccine responders. So staff that works clinics for either vaccination or testing, as well as the volunteers that are assisting us. And we've also gotten volunteers that are assisting other healthcare organizations in their COVID response. So getting them vaccinated because they are, on the front or further front lines than some other folks. And then we moved on to 1B. So that included our populations with medical needs. So what happened is that with those populations with 2 or more medical comorbidities, those had to be provided, or physicians had to provide attestations for those staff, for those individuals, to say that they were actually diagnosed with 2 of those diseases or conditions. So those aren't really the folks that we're looking at because we don't have access to those medical attestations. Public health, on the other hand, has been tasked with some of the folks that are more at risk for severe illness or death related to COVID. So the individuals who have higher social vulnerability, according to the COVID Vulnerability Index, which includes some of our standardly vulnerable populations. So individuals that are 65 plus. So we've done a lot of clinics and have upcoming clinics at living residential programs for people who are 65 plus or disabled. It includes racial and ethnic minorities, people who are homeless or housing insecure, folks that have low income, folks that have lacked transportation and lack access to care. So those are the populations that we're tasked with providing vaccination to. And I think that speaks back to Alderman Lopez's, statement about finding out who's at high risk in the community, figure out what we have to do, and looking at the number of people that we vaccinate through public health as opposed to the total vaccinated within the state or within the city or region. So when we vaccinate folks, we're going for those targeted groups. Now, because the fact that I was at clinic this morning, I will pleasure you with the updated total, although it's been reported a number of times. At this point, we've provided 1,955 first doses of vaccine, 526 doses for second doses, and a total of 2,481. That's as of noon today, hot off the presses. And the first vaccine clinics we held were beginning on January 15th, so almost exactly 2 months. Okay. Some of the other populations that the public health networks have recently been asked to vaccinate include individuals that are homebound. Now, although we've been having conversations around planning for this for years, I've been with the health department for a long time, since 2008. So we've always talked about how we would get information or stuff out to the homebound population. But what we didn't know is some of the complications that arise with COVID. One of those including the 15 minutes observation afterwards. So we can talk about going out and vaccinating people, but when you have a vaccine with a shelf life of at room temperature of 6 hours, and you have to go screen, vaccinate, and then wait 15 to 30 minutes with individual people, and then go to another house and do the same with others, you quickly get to the end of the shelf life of that vaccine. So figuring out how to do that is very complex. We're working to do that, and the state is contracting with some of the local home care agencies, visiting nurse agencies, to be able to have them vaccinate, if not anybody that we get notified of, that at least their patients and their clients, so that those folks can get vaccinated in their homes. We have done some home vaccinations after clinics when we've had extra doses available, and a team of 2 of us will go over and stay there for the 15 minutes and bring the supplies with us that we need, as well as a med kit, so that we can address any immediate concerns that come up regarding their health or call 911. For the general population, we've really been focusing, working with those senior living facilities, as I said, the National Soup Kitchen and Shelter, some of our social service agencies that serve those higher risk populations, such as the Front Door Agency, Plus Company, Gateways. We're looking at Share in Milford because we don't want to just be in Nashua. So that's how we're sort of targeting and vetting those populations. And then the final group that everyone is talking about right now, to the tone of about 200 emails a day that I'm getting right now from people from different school districts, is school staff. So 2A opens for appointments on the 17th of March, and folks can either get vaccinated through fixed sites, or they can, if their public health region is planning to do vaccination clinics, they can get appointments there. The date, I have to tell you, originally we weren't told whether or not we'd be able to vaccinate school staff. The beginning of last week, we were told we could vaccinate school staff depending on what the state thought of our plans. Then they moved the date to March 22nd. We thought we could fly with that. And then right before the press conference, the governor decided he wanted to go with March 12th for public health clinics. So that caught a bit of us off guard. We still have arranged to do a region-wide public health vaccination clinic for school staff. Now, 2A also includes childcare staff and camp staff. But in order for us to vaccinate a reasonable amount of people and not overtax our resources, we want to focus just on the K through 12 school staff, which is a very broad group. It not only includes teachers, but everyone from coaches down to maintenance and contracted teachers. Like I had a group get in touch with me that do music in the Nashua School District. As long as they get a letter from their superintendent's office that they're contracted with them to work in the schools on a regular basis, they can be vaccinated. So we had been contacted by Fidelity Investments about 5 weeks ago, and the state was looking for a site for them to move their fixed site indoors. They decided Fidelity was not optimal for that, but Fidelity wanted to be involved, so they were given my name and they gave me a call. They offered us use of the interior spaces and the entire campus for to be used for vaccination. And the vaccination strategy group came up with the idea of doing that to K through 12 teachers on site. So planning has moved forward with that. We're going to do it outside, but they're going to be getting a 10,000 square foot tent for us to operate under. According to Ren's calculations, I should house about 80 to 90 people with their social distancing. So we need to get a second tent. We're going to have about 15 to 20 vaccination stations. Excuse me. And the same number of registration stations. I've sent an email out to all of the school districts within the region earlier this week. I had to wait till after a planning call that took place on Monday, I think. Today's Wednesday. And I've heard from every school district at this point, and they are all supportive of coming to this fixed regional site, except for one that wants to have their own clinic, of course. So can't always make everybody happy. I also reached out to all the non-public schools. They are all on board as well, ones that I've heard back from, which is the majority of them. In that email I sent out, it did not include a date or location because we want to make sure that our agreements are signed and our date is finalized. But I'd said it would be on a Saturday and we'd hold it as soon as possible. And it may or may not be before the fixed sites are accepting their appointments with teachers. In the email, I also included a doodle poll for folks to quickly go on, ask them to distribute it to their staff and have the staff go on and indicate whether they wanted to go to a fixed site, our regional clinic, or not get vaccinated at all. The overwhelming number of those, I think when I checked this morning, it was 150 or so people said they wanted to go to our site. 14 said a fixed site, or 12, and then like 6 said they didn't want to get vaccinated at all. So it seems like it's going to be a popular opinion. Our goal is to move over 2,000 people through that in one full day, starting at 9 o'clock in the morning, ending at 5 o'clock in the afternoon. If we need to, we're prepared to do a second day at that location to get the remainder of folks through, because we estimated it's a total of about 3,000 people that work for the school district that want to get vaccinated at the sites that haven't been vaccinated already.
Thank you,
Ballpark
Patty.
number.
Very much.
You're very welcome.
Yeah, I didn't mean to cut you off, but I did mean to cut you off because we were
Nope,
for doing
that's fine.
stuff. But I appreciate you coming on. And like I said, I haven't seen you in a long time, so it's always good to see you.
I know.
I do have a question. I think Alderman Lopez had his hand up, correct?
Yep. Just double checking. Did you say the Fidelity site, is that the one in Merrimack?
Yep.
Do you happen to know if they got rid of the tolls there or not? Because I'm wondering how that's going to affect traffic if we just suddenly send a couple thousand people in through
Well,
that.
the fortunate thing about that location is the traffic flow was built to cover about 20,000 cars a day because of the outlets.
And they're not currently active, like that site isn't being used by Fidelity?
Correct. They're working all remote.
Okay, because I worked there for a while and like the traffic going in and out at opening and closing time was horrific. Yep. So just making sure.
And we'll have a single entrance and a single exit with traffic control inside, and the size of the campus can have you could have 1,000 cars in there and it wouldn't be an issue.
Okay.
To any of the surrounding
regarding the tolls, do you know if it's active or not? Because we might be able to get the state to leave that alone just for them to go in.
The tolls are active, but we can direct people to use the 2 routes that would get you around the tolls, either coming down Continental Boulevard or coming down Daniel Webster Highway in Merrimack.
Okay. Just figured why make everybody pay extra money if they
Thanks,
don't have.
Tom. I know we thought of that too. We could at least get a kickback, right?
Merrimack.
They could pay for a van or something for us to tow our stuff around in.
Mm-hmm.
Any other questions of Patty? Going once, going twice. Thank you, Patty.
Thanks,
We're going
to.
I received, and I believe so have the other members of the board, a letter from one of our aldermen with a public comment regarding putting an end to the mask ordinance, putting a date to it. I won't read the letter. I'm assuming that Stephanie, you received a copy. Chuck, you received a copy. I kind of went through the letter, and as most of us do it in our training, we look for facts and we look for speculation and we look for things that are not really true. And then after I was done, I said, you know what, we can pick this apart all we want. When I finished reading the letter, the thing that hit me the most was that the person writing it doesn't have trust in us. And I understand that. I understand the frustration, not only as a layperson, but just as a professional person who has really been studying the virology and everything that's been going on for the last year, that one day something's fact, the next day 2 people prove it isn't fact. Some say to do this, other people say to do that, not to do that. We're used to that in our profession, to have robust discussions and have people critique the things that we scientifically discover. Okay, and that's normal. And maybe lay people aren't used to that, but that's normal. They think if a professional says this is what it is, it's got to be it. And I will tell you, in 40 years of practice, how many times things have changed. This was absolutely the God-given truth on something, and within months, somebody proved it not. And so would you scratch your head and say, I can't do that anymore? It's what it is, and I understand the lack of trust.
You literally call treatment practice. I mean, you're improving as you go.
Yeah, well, that's what it is. It's the art and science of whatever profession you're doing, and it is practice. Practice in a good way. One of the things that was in the letter that, what gives you the right to do these things? Actually, your city charter does. You've entrusted us, and I understand that. You've entrusted us to use our best judgment based on the available information that we have. And one of the things that I've seen that has gotten lost in all this is we talk about how many people are going to get infected. And, you know, if it's the over 65 group, I've heard everything from, unfortunately, well, they've had their time, something's going to kill them anyway. And being part of that group, I don't like that answer, but I understand where it's coming from. The vast majority of us shake it off and we move on, but you don't shake it off. A lot of people who have gotten this disease have significant after the disease problems, cognitive issues. For example, the Prime Minister of England, they were at the edge of pulling him from being the Prime Minister because cognitively he wasn't there after surviving in the hospital. So blood issues, there's all sorts of things that we don't know. So what we're doing is we're trying to protect everybody, not just the over 60 or the high risk group. We're also trying to protect the people that will get this and then later on may have issues and which we as a society will have to treat and pay for the rest of their lives, okay? We don't want to see anybody get sick. We don't want to see anybody die. And so that's really the basis of how we make our decisions. And we make the decisions based on the information that comes to us. It's not a decision of taking people's rights away from them. It's a decision of trying to protect people. And it's not about me. It's not about you. It's about all of us. This is where our generation now has to be the greatest generation to help things move forward. And I know it's inconvenient, and I know there's a lot of things. I was taken back a little bit about the masks can hurt us. Well, I've been wearing a mask for over 40 years, 8 to 12 hours a day, 4 to 6 days a week. I think we know the masks are not going to kill us. All right. I mean, that's what I'm talking about, misinformation. Let's keep it to the facts and let's move forward. I'd like to open the discussion with Stephanie first. Go ahead.
Hi, this is Dr. Stephanie Wolf Rosenblum, Board of Health. I think it's very important that people vocalize their concerns. And I have a newfound respect for aldermen who are constantly asked to comment on, provide ordinances on such an incredible range of topics that it is overwhelming for the various committees, ours included, especially now, to provide them with reasonable answers for them to address concerns of our community. And that is the spirit in which I looked at this. There are many people that are asking these questions, and it does not help. And this has probably happened since that letter was composed and sent, that some communities in the United States are holding mask burning parties. But I do think that a number of these statements are at best misleading and at worst completely false, uninformed. And I would like to propose, and I don't think we can do it here at this particular time, to answer these point on behalf, in service to the aldermen, so that when they're asked these questions, they can answer intelligently. You've given some important information in my career, both as a clinician and as a medical leader. I have to say, I dealt with many complaints and many concerns of physicians. I cannot remember a single time in the last 33 years that anybody ever raised, any clinician ever raised a concern about wearing masks, ever. So that kind of thing, and the information, the studies that have come out about the safety of masks, is something that should be brought to those people that need to answer the questions. Independent of the particular points in this email that was sent to us, the mask mandate will end. The question is when. And how do we respectfully and rationally state that without letting things go prematurely? And I think that in our exuberance, the royal we, in our exuberance, to be excited about the vaccines and excited about the spring and outdoors and excited about the decreases in illness and death, that we forget that only 15% of the US population has been vaccinated. We forget that, or we become inured to the fact that 1,500 people died yesterday. That probably almost every single one of them didn't have to die if they weren't exposed to the virus because they were distanced, masked, vaccinated. So to give into frustration and quarantine fatigue now, when we're on the cusp of having, you know, a plan, a way out, is premature by any measure. And we need to really see what's going to happen in the next month with St. Patrick's Day and Easter and Passover and spring break in the follow, because we were in a similar place before Thanksgiving, Christmas, New Year's, and we did have a spike. We don't want to lose people now when we know how to get ahead of this. And finally, I would say that we have to acknowledge, when we consider the timing, that as many as 23% of individuals have stated a preference or an intention not to be vaccinated for various reasons. I am praying and I am optimistic that with the kinds of education that we talked about today, with having people understand more about the vaccines, and with now having many months and many, you know, hundreds of thousands of people vaccinated, that we have not just data from the studies, but data from real life about how safe and effective these vaccines are, that number will decrease. But in the absence of that happening, it would be a travesty, in my personal and medical opinion, to not continue the mask ordinance for a period of time, independent what the state is going to do, because we all deserve to shop safely, to work safely, and to be out and about safely.
Thank you, Stephanie. I'd like to recognize Chuck because I know he has to leave early. Is there anything, Chuck, you would like to add?
No, I echo both of yours and everyone's sentiment here, and all the hard work, as always, for the board and the aldermen. I also give a shout out to the aldermen who, there are silent leaders here, though they get a lot of abuse that, you know, none of us really appreciate. So me too, and none of us are immune to the, you know, the onslaught of complaints and things like that. So as I read this letter, it was a concerned citizen. It was stating her opinion, respectfully in most of the cases, but at the same time, I love debates. If people know me, I love talking about opposite points of view. I like, you know, that it challenges me to kind of think outside the box, not only as a physician, as a person. So I think as the adults in the room here, a conversation I have with my parents all the time is, you know, we have to take this feedback as both constructive and not make it destructive. Because you can take it personally, you can take it, why are they shouting at us when we're the gatekeepers, we're trying to hold up the mantle of public health. But, you know, I will put my head on my pillow, as each of you do every night, for you're the front line, and saying, hey, we did our best. If we have patient public health front and center, and everything is based on science, but science changes. And I think that's, as you've echoed, Tony, too, that, you know, once we know something, we think it's fact, but 6 weeks from now, 2 years from now, because of the practice of medicine, we know it, you know, things evolve. So we have to evolve with it. So my point too is, as we've said, and I shared with the Board of Health this CDC article about March and April, the CDC director can be critical in how we go forward here. And the analogy that I thought was very interesting is we've had a long 365-day marathon, and it's the equivalent of when you're just about 100 feet from the finish line, you just decide to stop and sit down and give up. Well, that's, we can't give up. The masks are essential here, the social distancing, the tripod that they also include in the article about get vaccinated, obviously a public, personal choice. But as I share with parents, the reason I wear a mask is to protect you out of respect to you as a person, as a patient, as a family. I'd love to think that same respect could be had in reverse, but know better that it isn't always that way. So, I think we can't let our guard down. And I think it just shows, as much as we like to think we're making 2 steps forward, I think our public health careers are based on, we're only as good as today, because tomorrow brings another challenge.
Thank you, Chuck. I think I saw Tom's hand up and he went blank on me there, so I'm not sure if he's still on or not. One of the things I'd like to say, and I can't emphasize this enough, the people that work on the board work really hard for you, the citizens. Okay, I'm not a power guy. I'm not let the masses suffer. That's not who I am, and that's not what these other individuals are. We're trying to do our best job. I wish I had that magic wand where I could fast forward to the end, where we're out of this altogether. I just recently retired, and my goal for retiring was to visit my friends around the United States, maybe go other places. I've sat home. We canceled our 40th anniversary. We've canceled any trip this year. We are experiencing the same fatigue that you're experiencing. And I look at this as not a taking away of rights, but more of us trying to protect each other. Okay. You have certainly the right to get infected or not get infected, or, roll the dice, but it's not about you. It's, you might be carrying it and giving it to other people. And that's really what we want to do. And I will guarantee you, we are looking at the numbers. I sit on another task force that we look at the numbers every single Monday. We review them. We review what's going on. Right now, Nashua has one of the 2 numbers, and Angela can confirm this, that is higher than it should be. It's in a danger zone. What we're looking for, and I can disclose this to you, is we want those numbers to get down, show a trend, have the scientific evidence that we're heading around that corner, we're doing a good job, and then when the time is proper and should be, we'll remove it. For us to say, the end of the month, the end of next month, we can't do that. We can't foresee the future. What happens if we do something and then it spikes? Now we got to go through the process of all over again, trying to get the aldermen to put the mask mandate back in, and there's a lag time. So more people are going to get infected. It just, unfortunately, doesn't work that way. But I guarantee you, I want to make sure that you have our trust, that we have your best interests at heart, and we're working really hard as much as we can do. And you've heard some of the staff people talk about trying to get more numbers of people vaccinated. And that's really going to be the key. But we need your help to keep this from spreading. And that's the important thing. And you heard the new variant is even more contagious than what we have. So we have to work twice as hard, put it on 2 times speed, 3 times speed to get the vaccines, because that's the only thing that's going to get us to the end. Any other questions regarding the board, the aldermen? Any questions, any comments? Seeing none, I'd like to now open it up to public comments. I wanted you people to understand where we're coming from before we open it up to public. So it's now open. Does anybody have any comments? Feel free to speak. I will always fight for your right to say what you want to say. I may debate you, like Chuck said, and go head to head with you, but you have the right to say whatever is on your mind. Does anybody know if there's any public calling up or on? Does anybody know?
I don't see anybody on the participant list.
Okay, all right. I want to make sure everybody has an opportunity. I want to hear anybody say I wasn't given a chance to talk. What I'd like to do formally, because we're doing it informally anyway, we're looking at these numbers every week. And what I'd like to do is formally every month, from the board's perspective, from information that's given to us from Angela, Flavia, and the rest of the crew, the team, look at what's going on with masks. So the people, the public know that this isn't something that got shelved. Nobody's paying attention. We're all paying attention to it. Okay. And then we can go from there. I am looking for a motion to adjourn. If there is no other business or there is no any other comments, sorry. Seeing none, motion to adjourn. Chuck and
Yes.
Stephanie, those in favor?
Yes.
We are adjourned. Thank you very much, team. Really hard work as usual. Have a good St. Patrick's Day safely. Okay.